The conference is the third annual Frontiers in Healthcare conference that's been organised by the Health Economics and Policy Analysis Centre at NUI Galway in conjunction with Novartis. The theme of this year's conference is real-world evidence. We feel this is of extraordinary interest to many people, both academics, policymakers, private sector, and other people interested in how healthcare is delivered and how the maximum benefits can be gained from the money that is spent on health.
So real-world evidence has grown in importance particularly in the last 5 years, for a number of reasons. The most important one, in my opinion, is that we need to understand the real-world outcomes for patients. We need to have a really good understanding of the disease, its epidemiology, the patients, their safety, and to try insofar as possible improve those outcomes. No data set is perfect, so we need to understand the limitations of the data that we're using. There's a greater demand from different stakeholders such as payers, health insurance providers, governments, etc., who want to see beyond clinical trials that the evidence that we see from clinical trials is borne out in the real world.
For patient care, for the decision maker, for policy makers, for the payers, for so many different people, real world evidence is so important. And I think this can be epitomised by patient registries that are well run, that accrue data that is rigorous and robustly collected and then analysed in an appropriate manner. Because without that analysis, that dispels any weakness in that, because that's the way it is perceived to be, then we cannot stand over it. So really, I suppose I'm quite passionate about observational evidence, but particularly about patient registries and the accrual of good, robust data.
When we want to improve the quality of care in the management of patients with prostate cancer, we feel we really need to focus on outcomes that are important to patients themselves. When we associate those outcomes with the costs required to attain that outcome, we can develop a sense of the value of those treatments for our patients. We think there's a real opportunity to use value-based healthcare to improve the quality of care and the quality of survival for men with prostate cancer. And this kind of conversation at a health economics forum is incredibly valuable for us as clinicians who deal with prostate cancer and ultimately for our patients.
Something we need to enable real-world evidence meaningfully in Ireland in health research and healthcare practice, I think, is data storage, sharing, access and linkage. At the moment, that's particularly difficult to do here. We need to build a governance structure, build an appropriate legislation and develop the appropriate infrastructure and services. The HRB has launched such a report and we want to make that a reality over the next few years.
If you haven't been able to make it to the conference yourself, you're very welcome to look at the proceedings. They're going to be available online at the Health Economics and Policy Analysis Centre website. Google HEPAC at NUI Galway. You'll quickly find yourself on our site. Thanks very much, and I hope you enjoy watching the proceedings.